Good afternoon. I'm Monica Hendrickson, the Public Health Administrator for the Peoria City County Health Department, and welcome to our weekly press briefing. Beginning this week, we will reinstate our weekly press briefings. The decision to return to this platform comes after overall concerns regarding increased positivity and hospitalizations throughout the state. In short, we are trending in the wrong direction. Among the 11 regions in Illinois, all are showing over 6 days of continued positivity, as well as rates at or above 8%. Our own region, Region 2, has had 8 days of positivity increase. And while our med surge and ICU capacity in our region remain above 40%, the region has seen 3 days of increased hospital admissions. Specifically in the Tri-County, which includes Peoria, Tazewell, and Woodford counties, our to-date totals for cases sits at 7,495. That's an increase of 613 cases from last week. Again, to date, we are at 7,495 cases in the Tri-County, and that is an increase of 613 from the previous week. For Peoria County specifically, we're at 4,397 cases, Tazewell at 2,508, and Woodford at 590.
Wait, what is it?
Woodford County is at 590 cases to date. We are saddened to report the death of a Peoria County resident, a female in her 90s, who resided at Christian Bueller Memorial Home. That brings the total to-date count for Peoria to 61. Tazewell remains at 50 and Woodford at 15. Our Tri-County to-date total for deaths is at 126. That is an increase of 19 from the previous week. Additionally, the Tri-County hospitals of OSF St. Francis Medical Center, Unity Point Health Peoria, which is Methodist, Pekin, and Proctor, are reporting 15 ICU beds in use related to COVID and 47 non-ICU beds or med surge in use. They are also saddened to report 1 death in the past 24 hours related to COVID. What we are seeing is that our 7-day averages are on the increase. The Tri-County now sits at averaging 88 new cases daily, compared to last week when we were averaging 85. Likewise, our ICU 7-day average remains around 20, which accounts for 11% of ICU capacity in use for just COVID. And our med surge sits at 45. With these trends, it can be preventable. We know what works. Wear your face coverings. Wash your hands, and watch your distance. We're about to head into next week, which also includes the Halloween season, and then likewise following with Thanksgiving and then the winter season. One of the things we want to focus on is that there's great guidance out there regarding how to conduct social activities, as well as even Halloween, in a safe and healthy way. No one is canceling your ability to celebrate. All we're asking is that you do it slightly different this year, recognizing the fact that what you do will impact your neighbors and our community as a whole. So again, we want you to do what works. Wear your face coverings, wash your hands, and watch your distance. And remember, if you haven't already, get your influenza vaccine. With that, I'll open it up to questions.
Yeah.
Andy.
Thanks for having me. We have had 76 deaths since September 1st. We have had 43 deaths since October 1st. We had 50 deaths from March through the end of August. What actually is happening here? I get the cases are on the rise. We all know that. Are you seeing that there's a common thread that is taking place here? Are you seeing that the virus has become more have mutated? Do you feel that there is something happening within these long-term care facilities that is making all these folks die? Because most of those deaths are from there. Thanks.
So the question is regarding with the increases in the number of deaths that we've been seeing in October as well as in September, and subsequently what we've seen before. Part of this, and I believe Dr. Zike even addressed it too, is that this is expected, sadly. When you see increases in numbers of cases, you're going to see increases in number of hospitalizations, and those individuals that sadly the impact of the virus on them is mortality. So while we are seeing this increases in the number of deaths, it really is attributed to the fact that we are seeing increases in cases. The other part of the question was regarding our long-term care facilities. Our long-term care facilities really have been working under a spotlight, a magnifying glass, everything since the beginning of this virus, and they continue to do so. But sadly, the situation is they work and serve a highly vulnerable population. And that is why when the virus does come into a long-term care facility, the impacts are very sad. You see a large percentage of cases that do pass away. And so again, as a community, we can help by slowing down the virus. By decreasing the number of cases, we decrease the number of hospitalizations, and we also decrease the number of deaths. So really, when you're asking what we can do or what the long-term care facilities can do or what can anyone do, those things that we keep asking everyone to do, which is wear your face coverings, socially distance, and again, make sure you practice those hand hygiene and all the other type of activities we've been asking you to do since March.
You know, in your contact tracing efforts, if you could share with the public, where are you contributing most of the spread to? You know, I think on the national scale, people think of these, quote, large spreader events, but what are we seeing here locally?
I think we are now seeing in terms of from our contact tracing where these cases are coming. I would say in the summertime and around the holiday time is when you see these large super spreader activities. One of the ones I think previously that we had were related to a party at a fraternity in one of our local universities. Since then, we're now seeing this more of in smaller social gatherings. Still a large number of individuals, but again, what we're seeing is that people are starting to get complacent or feeling more comfortable around those that they're with. So when we talk about your household, and we say you need to practice social distancing and face coverings, especially those outside of your household, that means anyone that doesn't live in your house, that physical location. So I know oftentimes we think about our grandparents, our aunts and uncles who might live in a neighboring community. They are not in your household. You need to treat them as you would the stranger down the street. And it's not because they're not necessarily taking those practices, but you don't know who they've been in contact with and who those individuals have been in contact with. So again, what we're seeing now locally is going to be a lot more of people just kind of maybe getting complacent, putting their guard down. Nothing's intentional, but just understanding that this virus and how it spreads, we just have to be diligent all the time.
So you had said that I believe 11% of ICU capacity is just COVID cases right now, and of course we know other things like car accidents, heart attacks, everything else is still happening too, so the actual total usage of ICU is higher. I guess my question is, as a proportion, is COVID taking up as much as it was during the first wave back in, March, April? Is it more? Have we seen this kind of usage before?
So in terms of the 11% usage that we're seeing from our ICU, it goes in waves. So initially when the virus first appeared, we did have a lot of hospitalizations, but that's also because we were still learning. The science was just new enough to explain to our healthcare system the best mechanisms to handle the virus, right? And so now that we've learned more about it and, crowdsourcing on the healthcare community, that science has taught them this works, we should try this mechanism first or this medication first, we're getting better. So we did start seeing a decrease in ICU capacity because of that from the early stages. Now, sadly, it's going up because our cases are going up and more individuals are exposed, and those that need that ICU capacity are also increasing proportionally. So again, it does go in waves. Is it exactly the same as prior? Again, while we know more, it's changed our utilization of our healthcare system.
Do you predict it'll get to a level where, maybe the tents are necessary again?
So the question is whether or not we would be looking at some med-surg capacity issues, whether it's looking at outdoor, alternate healthcare situations. Hopefully not. And that's why the healthcare capacity, specifically our hospital admissions, our ICU capacity, and our med-surg beds, is something that's monitored at a county and state level and our regional level. It's one of the measures that kind of tells us, hey, we need to put the brakes and go backwards or mitigate some more. And that's because the one thing we do not want to do, and we talked about it early, is that the emergency that happens is when our healthcare capacity is unable to take care of the cases we have. And again, one of the best things you can do leading up into the winter to help them is get your flu vaccine. Because the flu vaccine will help decrease the number of people going into those beds. And so again, if you haven't, there's no excuses, get your flu vaccine. You can actually get your flu vaccine and get fuel points at a grocery store. Really, there is no excuse.
What I would like to ask is, you mentioned, I want to go back to the long-term care facilities. We are hearing all of these numbers, but I'd like to try to put it into some sort of context. Most folks don't pay attention to these type of numbers until now. How many folks normally die in a month or a week at a nursing home or in the county itself? Every death is bad, and every death we would like to not have, but at the same time, it happens. And how do we know that this isn't just a normal number, but we're paying on, we are looking at this one thing and we're not looking at other things? Can you do something to put it into some type of a context for us, please?
So the question is, the number of deaths that we've seen related to COVID, how many are additional than what would maybe normally happen throughout the year? We don't have that breakdown specifically for Peoria County, but nationally we do. In fact, the Centers for Disease Control and Prevention, or the CDC, did release a study that looked back from 2015 to 2019 and mapped out the number of deaths that we see by age groups, by types of mortality, and then compared it to this year. And in fact, they actually argued that Johns Hopkins is underreporting the total number of deaths, that we actually see more than is existing. And so we can actually share that link to that study to you after this.
Thanks.
Monica, when you talk about the influenza vaccine and then we talk about hospital capacity, and you mentioned how the two of them coming together is really vital, especially this year. Do you have, on average, what are we looking at an ICU capacity from just the flu, and then why is there a concern of the two coming together this year?
Well, I don't have the data specifically on the numbers for how much are in ICU capacity. What it makes it really important is that, again, influenza is a respiratory issue. So the same type of mechanisms and even the type of providers that we use in the ICU for influenza are the same that we're going to be using for COVID. So really it's stretching out an existing limited resource that we have. And so that's why it's really important. We have a vaccine for influenza. Why not take it and really, again, help our community as a whole?
And then going back to contact tracing, you mentioned, especially here locally recently, the big concern has been the small gatherings. You mentioned Halloween, but when you think of Halloween as a holiday, there is that advantage of, most of the time it is outside. You can make the mask a part of the costume. The bigger concern I know we especially are hearing about now is Thanksgiving. Families coming together, crossing state lines. When you're eating, you can't wear a mask. What's the recommendation from you right now?
So when it comes to Thanksgiving and the recommendations about how to proceed, when it's such a, again, a gathering of family and friends, I think the state guidance that was released on all social activities is just a really good rule of thumb. You can do it, and you can do your activities in a healthy and safe way, but it's going to look different. I myself usually attend a Thanksgiving with my immediate family. That's 35 plus individuals. This year, we're thinking about doing maybe virtual Thanksgiving. Everyone has it in their household. We put on a Zoom meeting and we enjoy each other's company that way. Or we do it in a much smaller group settings as well. Trying to do it outside, space everyone out as much as possible. The key is that no one's saying that you can't participate in these activities. We're just saying that you're going to do it slightly different. And I think as a community, we are flexible and understanding. And so again, no one's saying cancel, that we're not the no fun police, as I think my child calls me sometimes. The key is that it's going to look different this year.
numbers at all?
In terms of the outbreak at the federal prison, that's going to be really directed more towards Tazewell County. But I will just say, whenever we have an outbreak situation, Peoria County, for example, had gone through one working with our Peoria County Sheriff's Department, our long-term care facilities, Bradley University. When we have these, it does impact our numbers in terms of we see quick spikes. But what you'll also see is that testing happens rather quickly in these cases. So you are doing massive testing in a small amount of time. So it might show a blip, but at average, that's why we talk about 7-day averages or rolling averages, because when we look at it in a totality, we are able to control for those kind of spikes.
Monica, much has been made. You have said it. We have said it. We have heard it. Folks are getting tired of this. I mean, they really are. They're sick of the math. They would like their kids to go to school full time. They would like their kids to play sports. You are saying you could do all that just in a different way. How can you explain to folks right now, because you've got an audience here, that they really do need to do this? Says you, because nobody really wants to, and I think that's part of the issue that we're having. Nobody wants to do any of the things that you are saying.
So I think the question I'm going to paraphrase is really, we're at a point where there's a lot of fatigue in the community about COVID-19, the asking of masking, socially distance. And so I think the plea is this: no one is immune to this virus. We are now in October, going into November. We're not even a year into understanding this virus. The science is learning more and more every single day, almost every hour. And while I personally also feel the same fatigue, I would like things to go back to normal. I would like my kids to be able to see their great-grandparents and do all those activities. I also recognize that the impacts of what I do really do create a situation in which my neighbor, my friends, my parents could be impacted to the point of death. And I feel like if you were to tell someone that I need you to socially distance for a while, I need you to wear a face mask for a while, because at the end of the day, you're saving someone else's life. And I think that's the takeaway message. I think most people in the world will realize the fact that if you can be a superhero in this storyline, you can do what's right and help our community as a whole. And so I agree, it can be tiring. You have to remember a lot of things at once. You have to remember to have that mask ready. I've started driving down the street and coming back into the house because I forgot to have a mask. It can be tiring. But until we get a valid vaccine, until we have a way to medically take care of this universally, this is going to be our best line of defense. And if we can save one person, it's worth doing.
And to talk about the vaccine, the state just, Governor Pritzker and Dr. Ezike the other day just mentioned the state level plan for administering a vaccine when one is available. Is that discussion also happening on the local level?
So the question is about the vaccine campaign at the state and local level. And yes, part of what the state plan has was actually input from the local levels. So in the state of Illinois, we have what's known as the Emergency Preparedness Program, or Public Health Emergency Preparedness Program. It stemmed after 9/11, in which public health professionals were tasked with being able to provide medication to 100% of the population within a short amount of time. Since then, it's adapted, realizing that it may not be an anthrax threat. It might be avian influenza. It might be H1N1, and now it might be COVID-19. So with that, local health departments have frameworks that are available to execute a way of dispensing medication or vaccine to the general public in a quick and effective manner. Now, what we know is that we have the framework. We just don't have the details yet. And that's really based on what type of vaccine we're going to get, what temperature it has to be stored at, how many doses you have to have, how long you have to wait between these. Likewise, there's going to be prioritizations, because we won't be able to make all the vaccine with the snap of our fingers. And so how that's prioritized will work through ACIP, or the Advisory Council on Immunizations, as well as the guidance principles of what needs to be priority groups and how much vaccine we get. So there's a lot of details missing, but the framework exists. And locally, public health professionals have been practicing the variations of how you dispense this. In fact, in our own health department here in Peoria City County Health Department, we test a full-scale exercise routinely about every 3 years and do various trainings intermediately. And so we're just waiting to get those details so that we can start moving forward.
Monica, when you talked about some of the recent stats, when you said that we're trending in the wrong direction, especially looking at our own region, you're talking about those positivity rate increases, hospitalization increases. When are we as a region starting to look at when we could see those heightened restrictions that we're now seeing, I believe in the Chicago region that are having really strict restrictions coming down later this week?
So the question is, when would we see our time to maybe go back into the next tier 1 of that mitigation plan? And it's something that we are monitoring continuously, because remember, there's 2 data points that we're looking for, really actually 3. One is that positivity, how many days that we're trending in the wrong direction, as well as hospital admission. Then there's also another trigger, is when that positivity goes over 8% and sits there for a while, that's an automatic trigger. And then there are hospital capacity. Right now, our region, again, has a great and robust healthcare system. So if I have a crystal ball and kind of guessing at this a little bit, I would say it's not going to be your hospital issues that are going to trigger it. It's going to be that positivity number. And so that can happen rather quickly. Like I said, a lot of our regions are sitting now at 6, 7, 8% and starting to get higher and higher. The best way we can really work through this is get ahead of the virus. So get yourself tested. When you do get tested, isolate until you get your results. And then, of course, make sure you participate in that contact tracing when you get that phone call. And I want to reiterate to everyone that is listening that the contact tracing phone number you will receive will be a 312 area code. I understand it's a Chicagoland area code, so what do we automatically think in Central Illinois? That it's spam. But please answer that call. It will be your local health department. We're utilizing one phone number for the full state. So again, if it's 312 area code, please pick it up.
As far as the contact tracing goes, I have talked to some folks who have gotten a positive test and they have never been called. Are you trying to reach out to every single person who gets a positive test? Because I have talked to at least 2 or 3 who said that they've never gotten a call.
We do. Our goal is to contact every individual that gets a positive test that's a Peoria County resident. And I think the key thing to recognize is that we do have difficulty. There are people that block our phone numbers. There are people that will not return our calls. We send out letters too. So again, this is my ask. If you see that 312 area code, please pick up that number. Because one, if you tested positive, that's the first step in our contact tracing. But likewise, you might have been identified as a close contact. And so we need you to quarantine. So again, if you see that 312 area code, please pick up the phone.
What is the percentage of folks who do not pick up or who do not cooperate?
That's a great question, and it's regarding how many are unresponsive or uncooperative. In fact, the state of Illinois at the end of the month will be releasing metrics to actually show some of that. So there should be a more robust system coming out at the end of the month.
Monica, with local metrics continuing to rise, the last time that we were here, we talked about kids going back to school. We've had more kids go back since then. We talked about Halloween. The next round is coming, I think, here in a couple of days, where the next age group is going back. I have a child that's going back as of November 9th at the junior high level. With the timing of what's going on now, with the holidays coming, do you foresee problems at the schools as we get into Thanksgiving and Christmas time when those students are around more people than they typically have been to this point?
So the question is in terms of, as we come into the holiday season and the fact that our schools are coming back online, what does that mean in terms of the impact on school? And I think that's really key to understand. Our schools do a great job in their facilities. They are able to socially distance as much as possible. They've done different schedulings. They even have separated lunches and outdoor recesses. They have done a lot of policies and procedures to make kids safe and healthy in the school setting. The issue is, it's in the school setting. So we as a community and as parents and as guardians need to really work in terms of how do we help those kids and our schools keep them in play when they're outside of the facilities. And so again, if you do travel and someone starts feeling ill, don't send them to school. Get yourself tested, and again, isolate until you get those results. We really want to make sure that we can support our school districts, and the way we can do it is, as a community, do the work that's outside the school setting.
Is there any talk about delaying the higher grades coming back at this point because of the numbers going up?
I think a lot of our schools are looking at not only the numbers going up to see if they need to bring into remote work, or as well as even the holiday schedules. I know some of our colleges are not returning after Thanksgiving and going remote after. All of those looking at ways to minimize the risk.
Thank you.
Monica, going back to this again, you mentioned that hospitalizations isn't so much the concern in this area because we have so much capacity, very thankfully. I believe you had said we've seen 8 days of positivity rate increases. Correct me if I'm wrong in that. When you say we have to see a number of days of increases, that seems like a large number of days to me. What are we looking at?
So the metric regarding positivity is two parts. One is that one of the measures that we would use to go backwards would be you have to have increase in number of positivity as well as capacity issues in the hospital. They go hand in hand together. Or it's just a positivity of over 8%. And so again, I think we're going to be leaning to see that 8% first and foremost, rather than the other one where it's jointly attached to the hospital admissions.
And where are we sitting right now as a positivity rate?
Our community is just at 7%.
But Knox, right next door, is at 12%. And I know the closer you get to Iowa, the higher it goes. Seems like Rock Island's almost near 10, and we're all in the same, region. So I guess, how much are you guys coordinating or talking to kind of spread the same message, uniformly?
The question is, how do we kind of share that message within our region? And we have weekly calls with our regional partners, all of us expressing the same concerns because, again, we don't want to move backwards. We want to make sure we can transition. And I think a great comment that Dr. Zike mentioned was that we did it as a community to get us to phase 4. Let's make sure as a community we stay in phase 4.
What I would like to ask is, earlier today, the mayor of the city of Chicago was putting in some type of a curfew on businesses. And I think it was last night where they said how the ISP might be going around and being able to issue tickets for COVID. Mm-hmm. Have you heard of anything like this being done here?
Not here locally. The question was about enforcement of some of the capacity rules. Locally, we've not had to exercise any of the ISP or the law enforcement lens on that, because a lot of times it's really just communication and education. Because remember, our restaurants, our bars, our retail, and so forth, they're in it with us. They are very much a partner of our response. They don't want to move backwards either. And so they've been advocating to their patrons to make sure they follow those rules, because the last thing we want is to be able to have to go backwards. So again, we have had the advantage here that we've had great community support, and our business community has supported us too, because they recognize they are really much a partner in this response. So with that, we'll be back to weekly updates, and I believe they're going to be at 3:30 on Thursdays here. Thank you.